Hello, are you an adult who thinks you might have ADHD, or maybe you're an adult who was recently diagnosed with ADHD? Why wasn't this diagnosed in childhood?
The problems that you've had didn't seem to just come out of nowhere. You can probably remember half a dozen moments where it was painfully obvious that you suffered from problems with poor attention, poor executive function, or poor impulse control. Maybe some of the things you rather forget. If these symptoms were obvious to you, why weren't they obvious to a medical professional?
So today, I want to talk about a few reasons why your ADHD wasn't diagnosed in childhood. I'm Dr. Mike Feldmeier, child and adult psychiatrist at Level Up Mental Health. How are you doing? So one of the reasons you may not have had your ADHD diagnosed in childhood is you may just have had very good coping skills in childhood, and you didn't have any issues until later on in life, where job demands or possibly relationship demands become too much for your current coping skills. This can be because during childhood you may have been someone who was blessed with a high IQ or possibly very good resilience compared to other people who may not have had as much resilience as you. But there's no shame in admitting that you're struggling currently. As demands change and grow, some people may notice that their coping skills are no longer sufficient and should go get professional treatment. Another reason for not getting diagnosed in childhood is there are generational differences in medicine. There's unfortunately a lot of old school doctors who don't even believe that ADHD exists. However, it is a well-known and well-studied neurodevelopmental disorder with neuroanatomy changes and diagnostic criteria outlined in the DSM-5. Another reason you may not have had a diagnosis in childhood is because possibly you come from a culture or a family that doesn't put much stock in things like mental health or in ADHD as a process, and potentially you could have been told that it's because you were lazy or that you weren't trying hard enough. However, as anyone with ADHD can tell you, you're probably trying very hard in order to cope or cover up for some of the issues that do pop up with ADHD. And finally, there's much better screening tools, a much better systematic approach that psychiatrists and other mental health professionals take in order to diagnose ADHD as well as the comorbid issues that can occur, like depression and anxiety. People often ask me if adult ADHD is something that can pop up later in life, but probably it's more likely that it went underdiagnosed and you've had it your whole life. It just didn't result in any specific dysfunction. But if you think that you or someone that you know has ADHD, it's important to make sure that they go and seek professional help, get that properly diagnosed and properly treated. If you found this video to be helpful, make sure that you like, comment, or subscribe. Until next time, I'll see you later. Bye-bye.